Another remedy, anyone using for constipation? Anyone? Any remedy you are using in your practice for constipation? Lycopodium is also one of the good remedy for constipation, especially in pediatric cases. What is the indication of Lycopodium? Anyone?
Red sand in urine.
Okay, red sand in urine. Then that is
So
generally
left-sided
seen.
remedy.
That is generally seen in patient of renal stone. Not every patient of Lycopodium having such symptom. So, what are the indication of
Lycopodium has traveler's constipation.
Sorry,
Lycopodium has indication in traveler's constipation.
traveler constipation? You are talking like this? Zainab, traveler constipation?
When the person is traveling,
Okay, traveling. I
करते
don't
हैं
know the
अगर patient.
indication during traveling, but I am using platina for such thing.
Yes,
Platina.
platinum.
Yeah, platina is the remedy for traveler constipation that is mentioned in Boric. Open your Boric. It is mentioned in Boric. Open Boric platina. Can anyone read it?
Constipation of travelers who are constantly changing food and water.
Yes. That is the platina. When you get the patient, I am working in some corporate company and I have to travel a lot. And when I change the location and water and food, I get constipation. You can think the remedy that is platina. Lycopodium indication.
Potency, sir?
Sorry.
Platina in which potency?
200 potency.
Okay.
200 every week. Simply 200 gives relief. Lycopodium, guys. Anyone indication of Lycopodium in constipation? When patient is telling you, sir, first stool is hard on me. जब भी मैं स्टूल पास करने जाता हूँ या बच्चा स्टूल पास करता है तो पेरेंट्स विल टेल यू कि वो जब भी फर्स्ट स्टूल आता है तब उसको जोर करना पड़ता है, उसके बाद स्टूल इज रिमेंडर. The indicated symptom of Lycopodium is this. Yes, Zainab, that symptom is mentioned in FATA. As you say कि travelers का जो constipation होता है, that is mentioned in FATA. I'm not using Lycopodium for travelers constipation. I'm using platina for that. Constipation for children, ineffectual urging for contraction of sphincters, feeling as if much retained unpassed after stool. Stool contains sand, smell, difficult, and the most important, first part is hard, is difficult to expel. Last part is soft or thin and gushing, followed by faintness and weakness. So after passing stool, when we see the weakness or faintness, think of Lycopodium. Lycopodium desire.
Sweets, sir. Sweets.
Desire for sweet. और कैसा फूड पसंद है उसको?
Hot and warm.
Hot and warm, yes. Especially soup. This is the desire of Lycopodium. Any other remedy you are using in your practice for constipation, guys? Lycopodium is one of the good remedy for evening colic in pediatric patient. Evening colic, शाम को दर्द होता है. That is very common and there is no remedy for evening colic in allopathic science. They are using colicate, they are using antispasmodic remedy, but there is no cure with such medicine, and parents are very much irritated for such thing. शाम को 6 बजते ही बच्चा रोना शुरू हो जाता है, 6 बजे से 8 बजे तक रोता रहता है. What are the time modality of Lycopodium?
4 to 8 p.m.
4
Yes,
to
this
8
is
p.m.
the time modality of Lycopodium where pediatric patient having aggravation. शाम को तकलीफ बढ़ती है. And in Phatak, there is mentioned colic in babies, aggravation evening. So we can think of this remedy for evening colic. Any other remedy for pediatric patient colicky pain? Yes, Neelam, remedies for evening colic. You can think of colocin, you can think of phos, you can think of Digescoria. One more remedy, yes, Zainab, phos is always there. One more remedy, that is Calcaria phos, open Calcaria phos. When bacha having colicky pain during the dentition period, think of Calcaria phos. We prescribe today only in evening OPD. Let me confirm in Buri. Is it mentioned? Let's check. Did anyone get such symptom? Calcaria phos.
Diarrhea from juicy fruits or cider during dentition.
Okay. Then
Green, slimy, hot, sputtering, undigested with fetid flatus.
okay.
Fistula in ano alternating with the chest symptom.
That is in Calcaria phos, right? You are reading from Boric, right?
Boric.
The colic is mentioned in abdomen. At every attempt to eat, colicky pain in abdomen, sunken and flabby, colic, soreness, and burning around navel. When during the dentition period, when there is colicky pain, parents are telling you कि बच्चा रात को उठ जाता है due to abdominal pain. During the dentition period, you can think of this remedy, that is Calcaria phos. In such case, you can use Calcaria phos in 1 potency. We are giving 1 potency single dose. Even there is diarrhea from during dentition period, we can think of this remedy, that is Calcaria phos. Green, slimy, hot, undigested, and fetid flatus. Calcaria phos का physical structure कैसा होता है? Anyone?
Pot-bellied, open frontanels, weak legs.
Yes. That is typical बच्चा of Calcaria phos. Uska abdomen is distended and all the other part are very lean and thin. In those cases, you can think of this remedy. Even frontanels are remain open for long time. You can think of this remedy, that is Calcaria phos. And in schoolgirl, when they are suffering from headache, what are the remedies?
Natrum,
Schoolgirl headache, natrum,
phosphoric acid.
phosphoric acid,
I think Cilicia also.
Cilicia, yes. One more remedy add in your list, that is Calcaria phos. And one more remedy add in your list, that is argentum nitrate. So schoolgirl headache, is it mentioned in Boric? Let's check. That is not mentioned in Boric. That might be in the keynote or somewhere else. Calcaria phos का जो बच्चा होता है या फीमेल होती है, she is lean and thin and little bit dark in color. तो आपके पास जब भी टीन एज में बच्चा आता है, who is dark in color and lean and thin constitution, uske hands and limbs are very much lean and thin, in those cases you can think of this remedy. And having school headache, the remedy is Calcaria phos. Is it mentioned in keynote or somewhere? Keynote mein to Calcaria phos hai ya nahi? Yes, that is mentioned in keynote. Headache of school girls, bracket mein netramure, and another remedy is sorinum. And ununion of bonds promotes callus. Rickets ke liye specific, as we discussed the picture of bachcha. The cranial bones thin and brittle, frontanels and structures remain open too long or close or reopen, delayed and complicated teething. In those cases, we can think of Calcaria phos. School girl बच्चों के अंदर या स्पेशली गर्ल्स के अंदर when we get the acne, we can think of this remedy that is mentioned in keynote. Keynote constitution, last line, at puberty, acne in anemic girls with a vertex headache and flatulent dyspepsia ameliorated by eating. So when you get the acne in school girls, you can think of this remedy, that is Calcaria phos. When you get the Leukorrhea in school girl, what is the medicine?
Creosote.
Creosote, we can think of. Any other remedy?
If it's with backache, then Aesculus.
Sorry.
सर विद बैकएक है तो फिर एस्क्यूलस.
इसमें?
ल्यूकोरिया विद बैकएक.
Okay, done.
Syphilinum Moxol.
Syphilinum Moxol, okay. These specific remedies, sepia, guys. I am personally not using sepia in this age of group of people. Pediatric के अंदर or even in school girls, I am not frequently using sepia. But when we get the Leukorrhea in school girl, you can think of this remedy, that is sepia. That is mentioned in repertory, if I am not wrong. See, the rubric is female Leukorrhea children, girls little. The only 4-mark remedy is sepia. Moxol is 3-mark remedy, but the only 4-mark remedy, that is sepia. Even cyclamen is one of the good remedy. Even pulsatilla is one of the good remedy. But when you don't get result with cyclamen and pulsatilla, think of sepia. School girl Leukorrhea. Even Calcaria carb is also there, but the leading remedy is sepia. So that is about constipation. Yes, constipation. Any other remedy? मेरा बच्चा हफ्ते में एक ही बार स्टूल जाता है. बच्चा is passing stool only 2 times a week. कौन सी मेडिसिन दोगे guys? Not passing stool without giving purgatives or laxatives. Not passing stool without giving enema. मेरे बच्चे को एनीमा देना ही पड़ता है. Without that, I am not. He or she is not able to pass the stool. The clinical condition, you have to rule out thyroid in those pediatric patients. When there is excessive constipation, stool is not passing for 4 to 5 days. Always check for TSH. This is the clinical tip, guys. Don't forget to check TSH when patient having excessive constipation, stool is not passing for 6 or 7 days or 4 or 5 days. Yes, Zahabia, the remedy is Lecdef. Lecdef, that might be mentioned in Fatak if I'm not wrong. Open Lecdef from Fatak. Ellen में है? Let's check Ellen first. Open Lecdef from Ellen. Anyone got such symptom? In Lecdef keynote, there is mentioned constipation with ineffectual urging, anacardium and nux vomica, feces dry and hard like bryonia and sulfur, stool hard, large, great staining, painful, extorting cries. बच्चा रोता है. ये क्लार्क में मेंशन किया है मरियम.
Yes, sir.
Continual persistent constipation ameliorated only by catheterics or enema. Powerful purgatives were of no avail, or feces dry and hard, passed with great staining. That is mentioned in Clark, guys. एनीमा के बिना स्टूल पास नहीं हो रहा है, परगेटिव्स और लेक्सेटिव के बिना स्टूल पास नहीं हो रहा है. Think of this remedy. That is Lecdef. It is excellent remedy. One of my patients suffering from Down syndrome, I am using this remedy since 5 years for this Down syndrome as well as for constipation as well as she improves a lot. Her TSH is remained normal.
सर सर एक ऑटिज्म का पेशेंट है, उसको कॉन्स्टिपेशन ऐसा है कि उसकी मॉम बोली टॉयलेट में से कितना भी डालो पानी वो स्टेन ही नहीं जाता है, मतलब इसको जब स्टूल होती है स्टिकी. ओके,
Yeah, stickiness. This is what we have to ask the patient. When you are thinking about stickiness, patient relatives को बोलो कि पेशेंट को बोलो कि भी आपको पानी ज्यादा डालना पड़ता है. जो ज्यादा पानी डालना पड़ता है, which indicates कि stickiness is there. So sticky stool कौन सी मेडिसिन है? Guys, stickiness jelly जैसा.
Graphite?
ग्रेफाइट इसमें स्टिकीनेस.
Graphites?
Platina.
ग्रेफाइट इसमें शायद तक हार्ड स्टूल है. ओपन ग्रेफाइट.
Graphite इसमें वो है कि
Graphite is all about dryness, if I'm not wrong. Open graphite. Yes, Archit, Kali Beach is the indicated remedy. आप अभी भी एक्टिव हो. Happy to see you. Next session आपका है. Be ready for ADHD.
Sure, sir. Definitely.
The indicated remedy for sticky stool is Kali Beach, Calibacromicum. Guys, graphitis. Anyone got constipated symptom in graphitis? See, constipation.
from Alan I can read.
Please. Please read.
Chronic constipation, stool difficult, large, hard, knotty with lumps united by mucus thread too large, smarting sore pain in anus after stool.
See, there is mucus is there, but stool is hard and knotty. So when stool is hard and knotty, वो generally stick नहीं होता है. Next.
सर रेपर्टरी में काली बाई के अलावा प्लैटिना और हेलेबोरस भी है 3 मार्क.
Okay, okay. काली बाइक्रोमिकम निकालो. काली बाइक्रोमिकम is all about jelly in stool, stickiness in stool. Even you can think of Kali bichromicum in ulcerative colitis. Ulcerative colitis ki this is the indicated remedy. Kali bichromicum. Can anyone read Kali bichromicum? Kali hydradicus is Kali iode, right? So that is the Kali bichromicum.
Sir,
Ah.
shall I read?
Yeah, please.
Kali bichromicum, right? Sir?
Yeah, Kali bichromicum.
Jelly-like, gelatinous, worse morning, dysentery, tenesmus, stools brown, frothy.
Sensation of plug.
Sensation of plug in anus, periodic constipations with pain across the lines, and brown urine.
So इसमें jelly like stool होता है which indicates patient having stickiness.